The rise in coronavirus cases is having a major impact on local hospitals. The governor says nearly all beds dedicated to COVID-19 patients are currently in use. Tonight, Rhode Island's field hospitals are on standby. 12 News reporter Logan Wilbur reports on the governor's concerns moving forward. Logan?
Governor Raimondo says hospitalizations in the state are increasing faster now than during the surge this spring. She says if the state doesn't turn it around soon, there will be more pain, suffering, and mortality than there needs to be.
Our hospitals are at 97% capacity of their COVID beds, and dozens of folks are showing up every day.
The Rhode Island Department of Health announces the largest single-day increase in hospitalizations, with 53 people admitted to state hospitals, totaling 298 hospitalized due to COVID-19.
We are on a very bad path to overwhelm our hospitals, so something more has to be done.
The governor announced a two-week pause aimed at slowing the spread while hospitals deal with staffing shortages and a lack of beds. Care New England's Kent Hospital is properly staffed for its current patient volume, according to the Director of Public Relations, Raina Smith. Like hospitals across the country, Smith tells 12 News there are times that Kent Hospital needs to board patients in the emergency department. These patients will get beds in the main hospital once current patients are discharged from the hospital. Dr. James Finale of Care New England previously explained additional reasons why beds aren't readily available.
The nursing homes are reluctant to be able to accept discharges now, so a nursing home patient of ours that would normally go to a nursing home may spend an extra 2 days in the hospital waiting to find a bed that will take them because of COVID.
The way we get beds quickly, if we overrun our field hospitals, is to start shutting down other procedures at hospitals and to go to crisis standards of care. And any doctor who's been, or a nurse or a patient, who's been around for crisis standards of care will tell you, you don't want to be there.
Though hospitalizations are up, intensive care patients and the use of ventilators are lower compared to this spring. Still, the governor warns hospitals and healthcare providers would need to stop elective procedures and general checkups if we continue on the current trajectory. Reporting in Providence, Logan Wilbur, 12 News.
Even with 2 field hospitals ready to go, governor says it will be very hard to staff them. 12 News reporter Logan Wilbur continues our team coverage with a look at the hospital capacity.
After the largest single-day increase in hospitalizations, Governor Raimondo paints a dark picture for hospitals in the state. 298 Rhode Islanders are in hospitals after 53 new patients were admitted on Wednesday. The governor says as hospital beds dedicated to COVID patients reach 97% capacity, field hospitals are preparing to open.
Our Cranston Field Hospital will be ready for next week. The Rhode Island Convention Center Field Hospital will be ready by December 1st.
As hospital beds fill up, Raimondo warns of how the state would handle additional surges in patients.
The way we get beds quickly, if we overrun our field hospitals, is to start shutting down other procedures at hospitals and to go to crisis standards of care. And any doctor who's been, or a nurse or a patient, who's been around for crisis standards of care will tell you, you don't want to be there.
Raimondo announced a 2-week pause aimed at preventing the state from reaching the crisis standards of care. She adds hospitals are still experiencing difficulties even though the state is seeing fewer intensive care patients and fewer ventilators being used. Those issues will only get worse, Raimondo says, if Rhode Island must open both field hospitals.
The hard part's staffing them. It's the staffing. There's massive shortages all over the country, and people are tired and burned out, frontline healthcare workers. So it's the staffing where we'll get into trouble.
Crisis standards of care, according to the governor, would mean no elective surgeries or procedures, no screenings. She says doctors have already seen advanced cancer in patients who did not have their appointments this spring. Reporting in Providence, Logan Wilbur, 12 News.